today. We have proved once again here in Dallas, Texas, that we're able to take a contentious issue that has plagued the country with not only crowds that are frustrated, but other people who I think have diminished the issue and brought it here to Dallas, Texas today, openly talked about the two sides, made sure we talked about it in a thoughtful way, and I'm very proud of that. I will tell you that it's very important that we have this national dialogue. The American people need to have confidence that the plan, which is passed by Congress and signed by the President, has not only the approval, but also the backing of the American people. And up to today, you have seen a concerted effort by at least probably 80% of the people who've gotten involved to demand what they want. I believe it's important that we utilize some compromise, that we take the best of both sides, that we take Republican ideas, which I have presented here today, that includes allowing every individual to have the advantages of the tax code that corporations have, that we not diminish jobs. 4.7 million jobs is the response from the administration about the impact, and diminishing Medicare, which would put millions of seniors at risk and exacerbate that time frame for bankruptcy. So, I believe what took place today is two sides who spoke. Sometimes we spoke past each other. Mrs. Johnson already has her perspectives, and so do I. But the American people now need to be heard from, and I think that they will make the health care legislation even better, and then Americans will know the truth instead of fiction about how we can make health care better for the 21st century. Quality health care where people have an opportunity to visit with their physician, and that physician and that patient make decisions as opposed to a bureaucrat from Washington. I'll now take any questions that you have.
What do you think about the, and I'll ask you, look center there. What do you think about this new cooperative plan? The Obama administration says they may be willing to compromise, take public health care off the table, and go with a cooperative plan.
Well, the best cooperative plan was really produced by Republicans, and it's what's called associated health care plans. And it will, for it to be successful, it will require that individuals are allowed to get insurance across state lines. It will allow individuals such as all realtors to be a part of a nationwide pool. That is how you reduce costs. That is how a healthcare organization that's insurance would be able to make a go of it. Large pools, large plans. I believe that what the Obama administration is proposing with these co-ops are way small, far too small to be able to adequately handle the needs of an effective and resourceful plan whereby it could be paid for. So on its surface, I'm willing to look at it. It needs to be broader, bigger. It needs to be across state lines. It needs to include people who have commonalities. And the major part of this should be that what we want to do is to focus on two activities. First, wellness, and secondly, where we have people who have chronic illness. Chronic illness is a problem that insurance can work with. Wellness is an opportunity where people can get better rates. And both of these activities in large pools can accommodate, I believe, the problem quite well.
How do you read the signals over the weekend with the White House saying, well, maybe not public option, maybe, is there something politically going on, or is this some sort of a two-step, political two-step?
Well, what's going on is some people could say they have the best salesman, a horrible product. The product that they're selling of a government-run healthcare plan that taxes business to where we will lose 4.7 million jobs and cost $1.5 trillion today that is not being paid for, and diminishing Medicare, taking $500 billion out of Medicare and accelerating its demise is not a good plan. I believe that the President and Democrats, not only in the Senate but also in Nancy Pelosi, are recognizing they have not just a bad dog that they're hunting with, but a losing dog. And this is a dog in any way you could look at it, and they will not have the votes for it right now. So they're trying to stumble back to a position where they can get more votes. it is still a bad bill. And as long as it does not include the compromises of the marketplace that Republicans want to bring into place to where it can be paid for, to where quality health care will be involved, and to where we better the marketplace, better health care for all Americans, it is not a bill that's worthy of the president signing it. Where the president has compromised today is simply an acknowledgement that they do not have the votes in Congress because it's a bad bill.